Kirsten said, my name is Jessica Wald, and I am a speech language pathologist. I've been a speech pathologist for 20 plus years, and I've worked all of my career in a hospital setting working with adults. And I still work for Courage, Kenny, and Alina very part-time. And then I am one of the directors of MnCAN, which is Minnesota Connect Aphasia Now, which is a nonprofit organization here in Minnesota focusing on helping people who have a diagnosis of aphasia or primary progressive aphasia. And everything I'm presenting today is a kind of about after stroke, like what we do as speech therapists to help people with language disorders or cognitive disorders, swallowing or speech disorders. So I'm hoping that you find at least a part of my presentation helpful, or maybe you can relate to some parts of my presentation as well. And please feel free to ask questions if you want, or give an example of something maybe you've experienced as well. And just so everyone knows that anything I say in this presentation is based on my experience as a speech therapist, and it's not diagnosing anybody with a certain disorder. That would be by a full assessment with a medical professional. So today we're just going to talk about the role of a speech language pathologist, or SLP. So if you hear me say SLP, that's what I'm talking about. And after stroke. And then we're going to talk about aphasia, dysarthria, apraxia, and talk about communication tools and strategies. We're going to talk about cognitive and emotional changes after stroke, and then swallowing difficulties after stroke. So the role of the speech therapist or speech pathologist. So we are trained in many different areas. So I have my master's degree, and all speech pathologists have their master's degree. And some people might go and work in a school with children, and some people might work with adults. It's a very broad, it's very nice because we can choose different areas we want to work in. I just happen to love working with adults and working with people, especially people who've had strokes, brain injuries, or things like that, because I just feel like when people are going through a life-altering situation, I try to be a positive person that can maybe help give them some compassion and empathy, but also encourage them and try to be someone that can maybe help them get better and be more independent and successful in what they want to get to and their goals. So we work with different areas of what we call cognitive linguistic communication. So that can be language disorder like aphasia, which we'll talk about more, speech articulation problems, voice disorders. So if you've had like the stroke has affected nerves that affect your vocal cords, or like your breath support to get a loud, clear voice out, other breathing disorders, and swallowing. And so following a stroke, most times in the hospital, maybe many of you went through this, but we usually start with a swallowing assessment to make sure that the person who had a stroke can swallow safely and gets nutrition safely. And then some people might need further diet modifications or another test of their swallow, which could be a video swallow, which is an x-ray, or a FEES, which is where they take a camera and go up through your nose and look at your swallow. We usually look also at speech, language, cognitive communication, voice, and breathing. Some people after a stroke need to have a tracheotomy where they're breathing with a tube through here on a ventilator. And so then that can affect obviously speech and swallowing and communication. So we work with that as well. And then we are trying to help make goals to help the person with the stroke and family move towards the direction of getting better, becoming more independent. And this can obviously go through many layers, which many of you may have gone through, which is in the hospital, and then you might go to either an intensive rehab program or a transitional care, outpatient, or home care. So many different levels of therapy can happen. So we're going to talk about some communication impairments. So aphasia is a language disorder, and this video, Kirsten's going to share the screen to show the video. I'm just going to stop sharing here for 1 second. So Kirsten, if you...
Language is an essential part of our lives that we often take for granted. With it, we can communicate our thoughts and feelings, lose ourselves in novels, send text messages, and greet friends. It's hard to imagine being unable to turn thoughts into words. But if the delicate web of language networks in your brain became disrupted by stroke, illness, or trauma, you could find yourself truly at a loss for words. This disorder, called aphasia, can impair all aspects of communication. People who have aphasia remain as intelligent as ever. They know what they want to say, but can't always get their words to come out correctly. They may unintentionally use substitutions called paraphasias, switching related words like saying dog for cat, or words that sound similar, such as house for horse. Sometimes their words may even be unrecognizable. There are several types of aphasia, grouped into two categories: fluent or receptive aphasia, and non-fluent or expressive aphasia. People with fluent aphasia may have normal vocal inflection, but use words that lack meaning. They have difficulty comprehending the speech of others and are frequently unable to recognize their own speech errors. People with non-fluent aphasia, on the other hand, may have good comprehension, but will experience long hesitations between words and make grammatical errors. We all have that tip-of-the-tongue feeling from time to time when we can't think of a word. But having aphasia can make it hard to name simple everyday objects. Even reading and writing can be difficult and frustrating. So how does this language loss happen? The human brain has two hemispheres. In most people, the left hemisphere governs language. We know this because in 1861, the physician Paul Broca studied a patient who lost the ability to use all but a single word, tan. During a post-mortem study of that patient's brain, Broca discovered a large lesion in the left hemisphere, now known as Broca's area. Scientists today believe that Broca's area is responsible in part for naming objects and coordinating the muscles involved in speech. Behind Broca's area is Wernicke's area, near the auditory cortex. That's where the brain attaches meaning to speech sounds. Damage to Wernicke's area impairs the brain's ability to comprehend language. Aphasia is caused by injury to one or both of these specialized language areas. Fortunately, there are other areas of the brain which support these language centers and can assist with communication. Even brain areas that control movement are connected to language. fMRI studies found that when we hear action words like run or dance, parts of the brain responsible for movement light up, as if the body was actually running or dancing. Our other hemisphere contributes to language too, enhancing the rhythm and intonation of our speech. These non-language areas sometimes assist people with aphasia when communication is difficult. So how common is aphasia? Approximately 1 million people in the US alone have it, with an estimated 80,000 new cases per year. About 1/3 of stroke survivors suffer from aphasia, making it more prevalent than Parkinson's disease or multiple sclerosis, yet less widely known. There is one rare form of aphasia called primary progressive aphasia, or PPA, which is not caused by stroke or brain injury, but is actually a form of dementia in which language loss is the first symptom. The goal in treating PPA is to maintain language function for as long as possible, before other symptoms of dementia eventually occur. However, when aphasia is acquired from a stroke or brain trauma, language improvement may be achieved through speech therapy. Our brain's ability to repair itself, known as brain plasticity, permits areas surrounding a brain lesion to take over some functions during the recovery process. Scientists have been conducting experiments using new forms of technology, which they believe may encourage brain plasticity in people with aphasia. Meanwhile, many people with aphasia remain isolated, afraid that others won't understand them or give them extra time to speak. By offering them the time and flexibility to communicate in whatever way they can, you can help open the door to language again, moving beyond the limitations of aphasia.
So as the video mentioned, aphasia affects communication. It's usually caused with damage to the language center of the brain on the left side, and it does not affect intelligence. So that's something that whenever I'm in the hospital, seeing a person with aphasia, usually it's very emotional and difficult. So I always remind the patient over and over again that your intelligence is still there, your wisdom is still there, you are still there. It's just you can't maybe get the words out or communicate how you want to. And so that's a really frustrating thing. And so some of you may have aphasia, and it is it can be very invisible too, where people don't know that you have it if you don't have other physical limitations from your stroke. I'm not going to go through this in detail, but there's different types of aphasia, and that's where a speech therapist can diagnose this, or a neurologist. But there's global aphasia, where every part of communication is affected, so speaking, understanding, reading, and writing. And then there's Broca's aphasia, where it's more trying to get the words out, and it's limited and slower. Excuse me. And then Wernicke's aphasia, or fluent aphasia, is where someone might talk very fluently, like I am right now, but the words might not make sense, and they might not realize that the words don't make sense. And then reading and writing are usually severely impaired also. And then there's anomic aphasia, where it's just difficulty finding specific words. But all of these types of aphasia are not cookie cutter black and white. They can overlap, and depending on what area of the brain is affected from a stroke. So if you have a hemorrhagic stroke, there's likely going to be more deficits because there's different parts of the brain affected, where if it's a small, tiny infarct or an ischemic stroke, that can just maybe be in one area. Aphasia can make everyday tasks challenging. So things that we take for granted, like saying good morning, or saying our own name, or a loved one's name, or I love you, or ordering something at a restaurant, texting somebody, listening or watching the news and understanding it, writing numbers. Numbers can be tricky with aphasia too. Reading your favorite book can be really difficult. So a lot of different things can be affected with aphasia. Additional consequences, obviously, if you're having trouble communicating, which is part of our everyday life, it can affect employment, being socially isolated. You can be very lonely or depressed. You can have a negative sense of self. You might feel like who you are as a person has changed. And this can be not just from aphasia, but after a stroke, and we'll talk about that later too. And then negative impact on finances. Caregivers, your family members might not fully understand or try to understand, but they have new roles that they're trying to help with all the things that you're going through with rehab and therapies and all the things. So having a stroke has so many different consequences, and aphasia has many similar to people with not having aphasia, but the communication piece is a little bit maybe different. And then there's other disorders that may go along with aphasia. So apraxia of speech is where it's not that you can't find the words, it's that your lips and tongue and teeth, it's a motor planning problem. So you might know like what you want to say, but the word dog might be easier to say than the word pharmacy, which has many different syllables, and your brain has to plan the motor or the movements of the lips, tongue, and teeth to say that clearly. I won't get into this more because it's hard to explain, but a lot of people who have aphasia can also have apraxia, and sometimes as a speech therapist, it's even hard for us to distinguish what is what, or if someone has both. So it can take a little while for us to figure that out. And then dysarthria is very common after a stroke. So if any people, who have a stroke have had a facial droop as one of your symptoms in the beginning of the stroke, you're likely going to sound a little bit like this, and that's dysarthria. So it's weakness of the lips or the tongue or your breathing pattern. So it could be slurred speech. It could be really quiet speech, It could be just some dysarthria is really hard to understand. It also could be what we call like a spastic dysarthria, where everything's really tight in your vocal cords and your throat, and it sounds really strained like this. It also can be very breathy, where it's really hard to get the sounds strongly, like your breath support out. So dysarthria is a blanket term for any of those weaknesses that affect the breath support and or the components that are helping with speech and communication. Okay, so left hemisphere stroke. So when you have a stroke in the left hemisphere of the brain, you often have right-sided weakness. You can sometimes have visual problems on the right. And when I'm facing you, it's probably looking backwards. You can have fatigue, emotional changes, which we'll talk about later, decreased attention or increased distraction, depression, perseveration, so doing the same thing over and over again. So often people with even aphasia might say the same word over and over again. So I might show someone a picture and they'll say, oh, there's a dog and there's a tree. And then they'll go back to like another, like let's say they're showing a house and they might say, and then a tree, and then a tree. So their brain can kind of get stuck on the same word or the same thing, doing that over again. Dysphagia, which is the fancy term for swallowing difficulty, and then speech impairments like apraxia and dysarthria. So with aphasia, and as you all know from a stroke, most people can continue to improve over time. And we talked in that video, it talked about neuroplasticity, so the brain's ability to kind of find new connections and heal over time. And I just want to tell all of you, no matter how far out you are from your stroke, and hopefully you've heard this from lots of people, but you know, I've done this for 20 plus years, and I never tell a person in the hospital or a patient a timeline of when they're going to get better, because we don't know. Everybody is so different. Your brain is different. Where your stroke is different. What you were like beforehand, you might be like someone that was really good with, let's say, abstract thinking, and that still might actually help you compensate for other things. And so there is really a hard determination, and really we can't really say how long someone's going to take to recover, because I've seen people recover, continue to make progress years and years and years from their stroke. So if you don't use it, you lose it. So I do want to say that, you know, keeping yourself mentally and physically active as much as you can after a stroke is really helpful. And that physical activity helps your blood flow, which helps get to your brain and helps you kind of stay doing well. This is just updated facts. That video said, I think over 1 million people in the United States have aphasia, but this is actually a more accurate fact about aphasia. And a few years ago, only like 8.1% of people have heard the word aphasia, and now we're up to 67 or 68%. So that's really improving with awareness of what we're trying to do in spreading education and awareness. So supporting people with aphasia, oftentimes showing a picture to somebody or giving a couple choices can help them maybe determine an answer. Sometimes if you just ask an open-ended question to someone with aphasia, their brain is really struggling to try to find the right thing that they want to say. But if you write down some choices or just narrow it down a little bit or ask yes and no questions, that can be helpful. Again, everyone's different, so this is just general kind of guidelines, but everybody's very different. Also talking a little bit slower, not talking too fast, and then allowing extra time for the person to respond can also be very helpful. Sometimes if you ask someone with aphasia, are you having any pain? Tell me on a scale of 1 to 10, that might not really be able to be processed in the brain, but showing the numbers from 1 to 10 or showing like a frowny face with, you know, the 10, like a lot of pain, and then a happy face with 0, those visuals can really, really help someone understand. Gestures, you know, facial expressions, those are all things that the brain is taking in when we're, you know, communication is not just words. it's the whole picture of what we're seeing. So all those things matter in when you're communicating with someone. And then cognitive impairments after a stroke. So when someone has aphasia, there is also evidence showing that many people with aphasia also have some cognitive changes as well, with attention, memory, executive functioning, which is higher level tasks. I always talk about driving as a very high level executive functioning task, because we need to be reading signs, we need to be aware of attention and reaction time, and we have to know what's going on our left, on our right, in front of us, behind us, what we're doing in the car, what other people are doing. So it's just a very, very complicated brain task. So that's a kind of a description of how executive functioning works. And then learning can be affected also after stroke. So up to 60% of stroke survivors may experience cognitive impairments within the first year. And as we mentioned, it can affect memory, problem solving, decision making, attention, and executive function. And then what we try to do in the hospital is identify these areas, but sometimes it might take a while to identify these, and we might not get to these until you're in the next level of therapy. Because if you think about trying to do an accurate assessment of a patient in the, let's say in the ICU, who has nurses coming in, doctors coming in, you just had a massive medical situation happen. You might be hooked up to machines. You might be not feeling well or have headaches or all these other things. I don't think any of us would do very well when we're getting an evaluation of how our thinking is going. So we take that into account. We try to get some information, but we don't base everything in that hospital assessment. We want to look further in outpatient or home care or skilled nursing facility to get more accurate information. And then that's going to go ongoing to kind of make sure that we're as accurate as possible. Some things that can happen after a right hemisphere stroke. So you can have difficulty with the thinking things that we talked about. People can have visual neglect or inattention on the left side. So some people don't even know that their left arm might be weak or their left leg might be weak. And it's not that, it's their brain is just kind of ignoring the left side in a way, which is, I've seen some patients where it's just really interesting because they might just only see like the right side of their food tray. And so we have to adjust and make sure that we're reminding people to look to their left, or we're putting things to help manage, either training them to look to the left by putting things on that side or having people go to that side to retrain the brain. Decreased strength or coordination on the left side. You can have spatial and perceptual challenges, so kind of having difficulty knowing where things are in space or knowing where you are in space. The brain kind of can get a little confused. There can be things with communication. Some people, even though they have a right hemisphere stroke, sometimes can have a little bit of trouble with language. And then emotional and behavioral changes after stroke. This is something that I think I want to make sure people do talk about to make sure that you're getting the support that you need. That's why groups like MnCAN, where we have aphasia support, Inspire, where we have people that you're able to relate to, right? So you're not alone and you know that you're with other people going through maybe similar things. I think that's really, really important, because having a stroke can be invisible. You can have invisible things happening that people don't understand. So I don't know if any of you have experienced this, but you can have changes with your emotions. So you can be more irritable than you were before, or less irritable than you were before, more angry. Your emotions might be very like extreme, or could be kind of what we call flat, or just very the same and not a lot of change with your emotions. Someone can be just not have motivation to do things. That part of your brain might be affected. And so I think I've heard some caregivers or care partners say, since my husband had a stroke, he doesn't want to do anything. He's, just sits there all the time. And I try to explain, like, in a kind way, that's not the person's fault. Their brain is not giving them that cue to get up and do something. So you might need to adjust making a list or like setting a timer to say it's time to do these things. People might be more impulsive, so they might say or do things without thinking ahead more than they did before. And then depression and anxiety can be significant after a stroke as well. So really making sure that, you know, everyone has the support that they need, whether it's through support groups, you know, medical professionals to help with, you know, medication, or going to a psychologist or a therapist to talk about the changes with, you know, either the person who had the stroke or the family that's involved. I think support groups are really, really important. And then just making sure that people can still participate in their life, so that you're able to still do things that you love and enjoy to do. So just making sure that people recognize that grief is normal and frustration after a stroke is normal. You have a huge, huge change in your life, and maybe everything you knew is totally different now. So knowing that that's normal and being upset about it is normal, but how do you move forward from that and not let yourself kind of dwell in that same space forever? So feeling those feelings is important, and knowing it's valid is really important also. And then getting professional help if you're still kind of struggling to get out of that emotional negative space is really important. As we mentioned, groups like Inspire, connecting with others who understand. So joining a stroke support group or an aphasia support group, that's really important. Leaning on your family and friends, educating people. So I think one thing that I've learned in MnCAN is every year we have a fundraising gala in September. And this year we had 250 people there, and half of the people in the audience were new people to MnCAN. And many of them were there to support their loved one who has aphasia. And I've heard from so many people with aphasia that having their family and friends come to something like that and seeing a room full of people that are going through similar things made such an impact on them, understanding like, oh, this is what I need to do to help my loved one, or this is a real thing that they're going through. Because having a stroke and having aphasia or having other impairments from your stroke can be so hard to explain to other people. And I've heard that from a lot of stroke survivors, how frustrating that can be. So just making sure that if you can get education to people in your life, that can be really impactful. Focusing on therapy. So working with a speech pathologist, working with OT and PT, working with tasks. Let's say you're done with therapy, because unfortunately we know that therapy can't always last forever. Working on tasks that challenge your brain every day, to just keep things challenged and moving forward. Practicing every day, practicing communication, practicing memory tasks. There's lots of apps and games that you can do to kind of challenge your brain every day. And then just celebrating when you, even if it's a small thing that you are able to do now that maybe you couldn't do, 6 months or a year ago, like make sure you're acknowledging those things. That's really important too. And sometimes the person who had the stroke has the hardest time seeing any progress, whereas people that maybe haven't seen you in a while, let's say a relative you haven't seen in like 3 months, might notice, oh my gosh, your walking is better now, or your talking is better now, or your speech sounds clearer. So if someone tells you that, I think sometimes we are our own worst enemy, where we're like, oh, you're just saying that to be nice. But it really can be true, because I think we're always the person that can't see the change or progress, as well as the outside world. Making sure you're moving your body. Physical health is so important, and making sure you're doing it safely. But moving your body and stretching, or other exercises to help reduce stiffness and support your recovery, and then resting when needed. So I've had patients say to me, well, my doctor told me I have to take a nap every single day. And that's a real thing. The brain needs to heal and recover. And if there's a lot of stimulation coming at the brain, if you're having, let's say you had a busy family event or something, and you really might need to rest for a few days after that, the brain and the body need to heal and rest. So making sure that you kind of listen to your body and take those breaks can really make a big difference too. Eating healthy. I'm not a dietitian or nutritionist, but we all know, whether we've had a stroke or not, that we need to fuel our body with healthy things. And then staying hydrated, and making sure you're following any recommendations from your healthcare team. So if you're on certain blood pressure medications or things like that, that you're doing what you're supposed to do with making sure that your body is as healthy as possible. And then stress reduction. We all can benefit from this, but stress after a stroke is obviously probably going to be there day to day, but trying to minimize that, because stress can lead to high blood pressure and lead to other things medically that we don't want to happen. So trying to do certain relaxation techniques. I know there's like free meditations you can look up on your phone or your device, and you could listen to like a 10-minute mindfulness relaxation thing that can just kind of calm everything down. And then they do have like adaptive yoga or adaptive things that you can do. Also with physical activity, I know there's different adaptive sports and recreation programs. I know through different systems within our Twin Cities area. So just maybe checking those out. They have like adaptive cycling and adaptive different activity, golf, fishing, etc. And then focus on what you can do. So sometimes after a stroke, or oftentimes people focus on, well, I can't do this anymore, and I used to be able to do this. So working with professionals maybe that work a lot with stroke survivors to come up with ideas on maybe how could you modify something to be able to still do it. I just learned about a program, now I can't think of what it's called, but there was someone that really loves hunting, and after a stroke feels like obviously that's maybe not the safest thing to do, but there's a program where people take people out to be with them while they're hunting and make sure they're safe, and are like accompanying them as like a buddy. And so there's just different things that we can modify. It's not maybe going to look the same as it did before, but if you really enjoy doing something, there might be ways to get back into that in a little bit different way. And then just using gratitude to notice progress and moments of joy. So maybe if there's something that you're like, oh, I couldn't do that before, and now I can do that. If you write it down and just keep little notes, that can maybe remind you of the progress that you're making. And then staying engaged and finding purpose. So you all being here today is showing that you are staying engaged and you are with others going through something similar, or finding hobbies or things that you enjoy doing. Life is short, right? We've all been through things, and you all have been through major health situations. And so trying to find things that you're passionate about and that bring you joy is really, really important. And then volunteering or joining community activities, and then setting small but realistic goals to help you with your confidence and your motivation. So just being patient also with yourself. I think, as we mentioned, there is no timeline necessarily after a stroke. Everyone can make progress at a different rate, and I believe you can continue to make progress ongoing if you are challenging yourself. I'm going to talk briefly about swallowing disorders after stroke, and then if anyone has questions or comments, I'm happy to chat too. So dysphagia is the word that we talked about. That's a swallowing disorder. And obviously when someone has a stroke or a brain injury, different muscles and nerves can be affected. And when we see someone in the hospital and we first check their swallowing, it's because we want to make sure that they're not aspirating things into their lungs and causing pneumonia. And we also want to make sure that someone is able to get enough nutrition, because the brain really needs good nutrition, especially right after that stroke, to heal and recover. And so some people after a stroke can't get enough in because they're too sleepy, their muscles are too weak, they get tired after even a few bites. And then they might have signs of aspiration, which is coughing or choking, having kind of a wet or gurgly voice. Your eyes might water because things are going down the wrong way. Oxygen changes might happen, or someone might get a fever. And then as speech pathologists, we might recommend modifying consistencies of food and liquids, making sure people are sitting up appropriately or reducing distractions in the room, because, you know, if you were able to multitask before, as we all take for granted when we're eating and drinking, we're doing many things at one time. And if someone's talking to us, or the TV's on, or my dog interrupted me, we don't realize how things are still kind of happening. And so after a stroke or something happens to those nerves and muscles, one little distraction can actually make someone choke or have difficulty swallowing. So our job is to really educate the patient, the family, and everyone to make sure that someone is safe when they eat and drink. And then just briefly, I'm going to touch on just resources in the community. There's a long list, and this is just a few that we mentioned, but so MnCAN that I work with is Minnesota Connect Aphasia Now. So it's for people with a diagnosis of aphasia or primary progressive aphasia, and then their care partners. We have lots of different programs. We have conversation groups that meet weekly in person or on Zoom. We have 20 different groups, actually. We have an aphasia book club. We have care partner support groups, and we have different activities that we do throughout the year. And then the Minnesota Stroke Association has a lot of support groups and different resources. I often refer my people in MnCAN to all of these other resources as well, because, you know, as somebody that cares about people after they've had a stroke or brain injury, I want to give them all the resources. And I think we're very lucky in Minnesota to have all of the different resources that we do have. The American Heart Association has some great handouts. The American Speech and Language Association has different handouts as well. And then obviously the Stroke Inspire program has so many great resources. And then there's tons of others that I'm not mentioning right now, but I love just hearing about and sharing different resources with people. So I'm always learning about those as well. And if any of you are interested in hearing more about MnCAN or our aphasia programs, you can go to our website or go on social media and follow us. And we have a monthly newsletter we send out with different things that are happening in our aphasia community. So just wanted to mention that as well.